The upcoming collapse of Medicare, which many are predicting. This is such an important topic, and it is mirrored across many Western countries right now. And it's very important that anybody who is either approaching the age of 65 or is over the age of 65 knows what is about to likely come with an unsustainable system and steps that can be taken both in preparation and when the eventual cuts happen, because these are sadly on the horizon. We're going to have an open discussion here as three doctors who do have a lot of patients in this demographic. And for anybody who does enjoy our discussions, please check in the links down below for our separate Doctors of Ojais channel, where we have a lot of exclusive discussions all related to your health and well-being. Dr. Ben, would you like to get us started then?
Yeah, this is a huge topic, a very important topic to anyone listening to this, especially if you're over 65, and all of us will get there eventually. So even if you're not, this is a very important topic. The country spent about $1.1 trillion in 2024 on Medicare, and they are projected to be spending as much as 10% of GDP on Medicare over the next coming years. So, I mean, it could get that high. Just for perspective, the country currently spends around 3 to 4% on military budget. So you can understand that is an enormous amount to be spending on this. And really, the big question is, how sustainable is that? Is that going to continue? Is this country able to keep doing that? And if it's not, what happens next that we're all worried about is there going to be massive cuts of services. I think anyone out there is able to see what's happening to them. There have been massive cuts for individuals. I mean, you guys can all see how hard it is to get basic services these days in the medical industry. So what I'm really worried about is what's going to happen when this increases and when this burden increases to the point, the financial burden to the point that they can't provide basic services. What are people going to do?
Yeah, that is so concerning. Yeah.
That's a really good point, Ben. I think it's already happening. We're seeing that many of you out there probably have a lot of difficulty getting in to see your primary care, getting in especially to see specialists. And that's from a number of reasons. One is we're seeing a lot of rural hospitals around the country being shut down. Hospitals are not able to have the services and the overhead to cover the services. So across the board, especially for seniors who will be utilizing healthcare more and more as people are living longer and longer, are not going to be able to get the care they need. And we are not equipped. And I think by the 2033 is when Medicare probably will collapse.
Wow. Okay. So this is why we want to really talk about this, because it affects so many people, so many of you out there. And those statistics, Dr. Ben, are astounding. So we're talking $1.1 trillion, which is way more than the GDP of most countries that we currently spend. And I've seen those projections as well, that it could hit 10% of GDP within a decade, or just slightly over a decade. Those are some projections. And yes, 3% on the US military, the entire military for comparison. And there's a lot of different factors involved here. Firstly, we have, of course, an aging population. I actually think that in some ways we're going to see life expectancy, or in many ways, life expectancy decrease because of the metabolic health crisis. But what I personally notice is that a lot of people who are already over 65 are way healthier than many people in their 20s, 30s, and 40s, where we have soaring rates of metabolic diseases. So while many people over the age of 65, I know many of you are in that category, you're trying to do the right thing, which we'll talk about. You have an expectation, rightly, of a good quality of life. You also want to know that the system is going to be there for you. And for any international viewers, Medicare is the government-funded system for over 65s in the United States. But I think we could mirror this conversation for the National Health Service in the UK, other systems across Western countries. What do you think, Dr. Ben, here? Because every year we see Medicare on the verge of not being funded. We know about cuts to the system. And by the way, we are not even going to talk about any cuts from a doctor's perspective. That comes second to what you need for your health. But do you feel the effects of the squeeze every year in terms of the people you see being denied certain services?
Oh, without question. So every year we see more and more bureaucratic things that are done to try to help the system save money. And they are always at the patient's expense. So you always see it. It becomes this game where healthcare facilities and other institutions are always trying to save money for their institution. But in the end, it's always the patient that gets hurt. And that's why this is so concerning to me, because I worry so much about if this is going to go in the wrong direction. I know it's the patients that are going to get hurt in the end. They're going to get denied services. They're going to have an abysmal time in the hospital. I can't imagine it could be worse than it is right now in many ways, but it certainly could be, I think. So that's why I'm so concerned about it.
It is really a complete denial of care. And I can say that in my office, the rise of prior authorizations, peer-to-peer reviews. So if you try to get a medication and it just gets denied, what's happening now is all the insurance codes and Medicare are just denying care across the board and putting the onus on the doctor to come up with enough, sometimes unattainable paperwork in order to get coverage. And I think it's really unfortunate. So we're seeing, and I can tell you in the past 5 years, it's skyrocketed. I think most medications, most standards of care treatment, which patients should go through, are being denied across the board because insurance companies like Medicare really inherently think that doctors may not take the extra step to be your advocate. And because of that, you won't get the test or the medication or whatever you need. And so it really is. I agree.
Yeah. And a lot of doctors sadly won't take that extra step. Dr. Peter, not one of those, is an amazing
it's tough.
cardiologist.
They make it extremely difficult, and it's getting worse and worse, and it will be done by AI, and there's lots of different steps are just going to cross the board, and you'll see it as patients that most of the things and rise of cost of medications across the board. And for the people who really have invested the most in Medicare are really going to get hit with some of the worst care.
Oh, it's awful. And by the way, if any of you find people have stories to share about being denied care which you need, please comment down below. We would love to hear from you as long as you're comfortable. Please share your story. And that is a great segue, Dr. Peter, into what comes into the mix. And we are going to talk about soon what you can all do to prepare for this collapse, which is likely to happen because it's unsustainable. But costs are soaring, and we know that people's health is deteriorating for a variety of different reasons. But let's talk about why costs are escalating so much. I mean, 1.1 trillion, I think that's probably an underestimate. But you have some thoughts on bureaucracy, how much we're spending on bureaucrats instead of patients who need it.
It's the corporatization of healthcare. And we know statistically there's about 10 administrators for every doctor. And I can tell you this, like I get emails from, all different hospitals I worked at about just all these jobs are being added, and none of them are really for direct patient care, and none of them are ever doctor driven. And we're really just facing this huge bloat of bureaucracy in the hospitals. And that makes it more like virtual capital companies are purchasing hospitals. That's why you'll see across the board, hospitals are merging because they can't sustain the amount of bloat that's in these hospitals right now.
Gone are the days, the good old days of the community doctor who would run an office, be an independent business owner, basically. Now it's all corporatized, and venture capital is loving these soaring rates of diabetes, cancer. They are cashing in, and everything ultimately falls on the patient. It's very sad what's going on, isn't it?
It's very sad. And what you end up seeing is it's this bizarre game of escalation that occurs. And what happens is Medicare and other insurance companies make healthcare providers and systems jump through hoops to get paid for the same services they were providing before. And they make these hoops ever harder to jump through. And what happens is the healthcare institutions find ways around it, and they get extra people they hire to deal with all the paperwork and the extra issues. And then Medicare ups the ante. And so you keep doing this, and it's just waste. All this money just disappears, and it gets more and more expensive. And in the end, it's the patients that suffer as always. And that's why it's such a frustrating backward system.
Yeah. And you throw in pharmaceutical companies who are obviously making record profits right now, other big business interests. And it's just taking away from everything you need. And for doctors like us who want to practice in a more traditional way, want to remember that ultimately it's all about you and forget all of the big businesses in the background, which are operating at these high levels as well. It's just, it really is so sad. And I deal with situations. In fact, one good one I think to talk about, I know you're big on this, Dr. Ben, as well. is when people get admitted to hospital, this whole inpatient versus observation status, which in itself has become an industry now.
Is so bizarre because it is purely an insurance Medicare issue that's about payment. And it becomes an enormous amount of the discussion and time that's taken up in the hospital setting. So you have a sick person, you're in the hospital, you're sick, and there are a ton of people in the hospital that are spending the vast majority of their day trying to figure out your category. Should you actually be an inpatient in the hospital? Or has the note been written appropriately, and should you actually be considered an outpatient? And this is so important with how the hospital's reimbursed and how Medicare pays and how insurance company pays. And it's an absurdity that this much time and energy and money is being spent on categorizing you financially instead of figuring out what's wrong with you, what do you need? So it's one of the many examples, and there are many examples of waste and a lack of focus on a patient, a focus on nonsense, really. I mean, on waste.
The time I've spent in hospitals that always made me feel really uncomfortable is when a coder would be emailing you. If you don't answer right away, they're really like persistent. So you may have a urinary tract infection, but they want to label it as urosepsis. That means they just try to make you look sicker on paper, and it's just a money grab. And it really is just trying to suck money out of the system, which is directed to the hospitals and not really to patient care. And it really is probably one of like the worst things I've seen in hospitals.
And this goes on all over the country.
Yeah,
this is just it's just a game. And to be fair, I mean, the hospital obviously wants to be reimbursed, and there are these categories that are there, but it's just the fact that we're spending so much time on this. That's ridiculous.
And what happens too is that hospitals inflate drastically the costs of healthcare in the hospitals because they know that, well, Medicare will just going to pay this amount. So if we inflate it even more, what's going to happen is we're going to get more reimbursement. But what it hurts some people the most is the people who maybe are not covered in some way, or for a procedure, they get hit with this really inflated cost. And you'll see it if you look at your bills from hospitals, you'll see huge amounts being charged for what we call facility fees, which are just mind-blowing that they could even charge that. And again, none of that money, I don't feel really is being funneled back to patient care. It is really being funneled to feed, again, the whole bloat of bureaucracy in the hospital and all these administrators. And I tell you, time after time, departments where one person ran a department, now there's like 5 different people with redundant jobs.
Yeah,
and
it's
and none of them are doctors. None of them have a say. And now they're telling doctors how to treat patients, how much time to spend with patients. And it's really just, it's horrible.
I have a story to tell actually about I want to come back to the inpatient observation. This was a few years ago, and there was a patient who had served in World War II, and he had actually landed on Normandy Beach. And he was there in the hospital, and this issue came up. And I remember his wife, I mean, they were both either late 80s, early 90s at that time. And this came up, and it was a stress to them. And I thought to myself, here is somebody who has served his country so well. And imagine when he was storming the beaches in World War II, being a complete hero, thinking that one day his country would put him in a situation where him and his elderly wife are stressing over this. It just left me with a horrible feeling in my stomach. Like, why would we do that? This is all artificial. This has also become an industry. I remember once being at a hotel, and there was a meeting of doctors and administrators who were specialized in this area of inpatient and observation status. And they were having these big discussions. And I was thinking, what doctor would go to medical school with the desire to do that one day? But you've created this whole business from this, and they're spending money on a hotel. They probably formed some sort of society, and it's all artificial. And at the end of the day, it should be about you, the patient. What are we doing here, getting sucked up in so much bureaucracy?
Oh, it drives me crazy. And I have certain primary cares now be directed, what you said, these organizations, like there's just health organizations where physicians are kind of forced to be in that are really made to send patients a certain way. And it's not surprising if you want to get sent to a hospital or see a doctor, sometimes your doctor may feed you to a different hospital because there's sort of a kickback with money towards the health organization. So it's never, and I've learned in healthcare now, and especially every single year, it's never about patient care. all the changes are being made in the hospital that I never feel are ways to improve.
Okay, everyone, I'm going to interrupt that awesome discussion for a moment to tell you about our expanding natural health and well-being store. We are very proud of our expanding store. We have natural immune inflammation support, bone support, memory support, heart support, sleep support, and our newly released premium organic lion's mane and organic chai mix. We've got some great reviews so far. Check in the links down below. ohiwellness.com if you're in the USA, North America, ohiwellness.co if you're in the UK, Europe. Also keep an eye out for our upcoming food and beverage products, including protein-thin snacks. All right, back to the discussion.
But I think you can hear from this is an unsustainable system. So what we're talking about, it's not one entity that is broken. It is an unsustainable system. And I don't think that healthcare systems or Medicare or the government has a great plan to fix this.
No, it's spiraling out of control. And this is also a great entry point into what we want to talk about next, how you can prepare for this, what you can do, because the trajectory is not something which is even remotely sustainable. We use the word sustainable, but this is like way off the charts, unsustainable. Unsustainable is not even a good enough word. So costs are spiraling. And this is why, however often they do it, Congress is like writing these things in last minute, saving the day because they know that people over 65 have to get healthcare. But how long can this last? You throw in the debt of the country, you throw in other factors which are weighing on the economy. Who knows what uncertainties might exist in the future? And it's imperative that everybody who is either approaching 65 or over this age of 65 knows that the system might not be there for them. So what can you do to protect yourself and even go outside of the system if necessary?
It's so true. And you have to prepare that healthcare system. And we always have thought that it will be for us when you get sick, and it is not going to be there. You see that when you try to get into a specialist, sometimes you have to wait 6, 7, 8 months. I mean, that's crazy if you have a really significant health condition. So you really have to be your own advocate. And that comes across all the board, especially a lot of the podcasts that we've done before is taking control of your health because no one else will. And so exercising, eating well, knowing your medications, getting off medications that are really causing side effects that you may not need.
And there's lots of those. But yeah, I like that you said that. Whatever you can do, and we've talked about these things many times, real food diet, optimize protein, cut back on the sugar, the carbs, the junk. Do you find, Dr. Ben, that exercising is something? I know that you have a lot of patients in primary care over the age of 65. A lot are not doing that as much as they should and could be taking steps. Yeah.
Absolutely. So there's an enormous lack of I actually had a patient today, so this is great, who had come in and had always been really frustrated about their cholesterol. Their cholesterol had been too high and they were really concerned. They kept bringing it up every time. And they said, how do I lower it? And I told them exactly what we tell you guys all the time. Now this patient did it. They started exercising regularly. They started small, just taking walks. And then they started, after weeks and weeks, taking jogs. And then they started doing some strength. And they cut out almost all the sugars in their diet. And they came back in and their cholesterol profile was almost perfect. And they said, I can't believe it. It was just exercise and diet. It was just, I just can't believe it.
Wow.
And I told her, I said, it's real. I'm telling you, this stuff is real and you will see it in all your labs, which we did. And you'll see it in your body. She felt amazing. Her energy was amazing. It was just so wonderful to see somebody do that. So yeah, it's very real. If you make these changes and you really stick to them, you will see it.
Yeah.
It's really the shift of being proactive from reactive. And if you really take control of your health, you can really just avoid specialists and doctors, and you really can't be relying on the medical complex. As we've talked about before, I mean, there is an oncoming collapse of it. And so by taking your own health into your own hands, it's going to really prepare you for what is going to really be a dire time in healthcare in the next 5 years, I think.
It is, yeah. And that is a wonderful story to hear, Dr. Ben. I have similar stories like that as well. That person reversed their insulin resistance, inflammation. And the reason why this is so important is when anybody reaches a certain age, the window of opportunity to reverse things narrows. Your lane is narrower. That's just a fact of biology. So you can't not take care of yourself. Like a 21-year-old can not take care of themselves for 2 weeks and bounce right back. But that's not the reality at 65. So all of these things become more imperative if you can get into the mindset of, I want to live the rest of my life as healthy as possible. I want to be there for my children, my grandchildren. I want to enjoy taking vacations. And I don't want doctor visits and medications to come into the mix. Of course, life can be unpredictable and you should still take care. If there's any warning signs, go and get help ASAP, nip any problem in the bud. But there's so much you can do. So something as simple as walking, eating whole food, very important, and making sure that you're being over-medicated. Now, of course, this is a discussion with you and your doctor, but Dr. Peter, do you want to speak more specifically? Because a lot of people over the age of 65 start getting sucked into the cardiology medical industrial complex. And it's so important to know that there's sometimes natural alternatives before the medicines.
Oh, absolutely. I mean, we know that medications aren't necessarily prolonging life, or being on lots of medications is not a predictor of longevity. Regular low impact exercises, keeping lean muscle mass, keeping good protein. I always tell patients when you're eating, it should be protein, plants, carbs, especially processed carbs last. And so that's really the first line. And then there's other type, natural ways of healing besides low impact exercise and certain supplements, which I take. I like magnesium. I think magnesium is really good for bone and rhythm health of your heart. It's also good for about 300 other biochemical processes. It's about lowering inflammation in your body, whether through diet or natural supplements like turmeric. I know that you've always been a big fan of turmeric,
yeah.
Sunil. And really, it's really just about getting away from that prescribing cascade where you go from doctor to doctor or go to a specialist like a cardiologist and get put on a statin medication. And then you have muscle aches and then you put on another medication to offset the side effects of other medications. And so it's really about just like cleaning the slate and just feeling better on your own and not relying, like you don't want to be getting healthier because you have an upcoming primary care visit coming up, or you're seeing your specialist. And lots of people do it, and we all do it at times, is, oh, I want to get my cholesterol better because I'm seeing a cardiologist. It's never should be for that. It should be for you. And if you do that and take control of your health and get on that, you will totally be so much healthier and really just avoid doctors, which always leads less medications as well.
That is the best way, to avoid doctors. As they say, the best way to deal with a system or anything that you don't like is to not need them. And that should always be the goal. I do want to talk about doctors in general, and I know you've got some thoughts on this, Dr. Ben, how difficult it is, and we feel your pain. It's one of the most common questions our team gets asked about how to find good doctors. Are they good holistic doctors in my area? And we so feel your pain that it is very, very difficult. And I wish, as I've said many times before, I wish there was a list of everywhere in the country with holistic, metabolic health focused doctors, and we could say, here you go. But no such list exists. And I think it's because it's very, very rare to find doctors who think outside the box. Extremely rare. I don't know many. I'm talking about primary care, especially, who think in that way. So that's obviously your field. Dr. Ben, if people want to go outside the system, what are your thoughts on the rising tide of concierge medicine for anybody who can afford it? And also in general about why primary care doctors are not so focused on metabolic health and longevity?
Well, that's a great question. These are complex topics. So concierge medicine, the problem with it is it's very expensive. So some of these concierge doctors, especially the luxury concierge doctors like in New York and some of the big cities, they can run you as much as $50,000 a year. Other ones that are on the cheaper side can be $10,000. So you're talking about a lot of money that would be spent on these. And then there's other costs. You still have to have insurance. So I don't think that's going to end up being a solution to all of this. Concierge doctors really make their mark by saying we are more available to you. We are able to get you testing, be more open-minded in many ways. So it won't be the paternalistic, this is how it's going to be. So there are some good things that potentially come with it. They're supposed to be very patient-centered. But again, it's really for usually the ultra-wealthy. I mean, it's very hard to afford a concierge doctor unless you have excess money, which can be hard. In terms of why primary care doctors in general are not focused on metabolic health, it starts very early. It's not stressed during the early learning. So you're not hearing about it a huge amount in medical school. It's not pushed in residency. You're taught about medication, side effects. Many of the guidelines, if not almost all of them, end with a medication, right? So if you think about all the major societies, their biggest contributors are usually pharmaceutical companies. And by no accident, often a guideline will end in various medications. So that is not an accident. That's been slowly developed over decades by pharmaceutical company influence. So really what's happened is there's been a kind of a brainwashing that occurred over decades of physicians, and that's why you're seeing how we got to this point.
Yeah, very sad.
So
Yeah.
true. With direct primary care, I have lots of feelings on this. As one of my patients said one time, it's kind of like a pig with lipstick. And, and I think that, you have to be really careful. And when you choose a direct primary care, you have to really know who the doctor is, because I always question, like, what are the qualifications to become like a direct primary care or like a VIP doctor? And a lot of it may not, you could just be really not a great doctor and simply just go down the route of that. So I know some great practices that are direct pay care. It's a different kind of model where they don't really necessarily take insurance. It's cash only, which can be really difficult, and that's really tough. But going back to why doctors don't concentrate on metabolic health and a lot of the stuff that we talk about is, you have to remember 70% of doctors now are owned by big hospital corporations.
That's true.
They're probably not allowed to talk about it. They're not given time to talk about it. And that's just a corporatization of healthcare, where most private practices or most primary cares are probably owned. And you've probably seen that as well, just looking at the mergers of hospitals. One practice being bought by a hospital, and then it changes and it becomes very like redundant, algorithmic, and corporate factories. I think that's the true reason why. I mean, I agree. I don't think it's really a lot of education in metabolic health, and I don't think people knew about it. I think there's more of an awakening, and I do see hope that I know my patients are starting to be more proactive than reactive, which is great. But I do think it's a bigger system and the bureaucracy of just owning the practices and controlling the doctors as a business.
Yeah, exactly. And I agree as well. The change is going to come from you. It's going to come from the bottom up. And I should distinguish as well between direct primary care and concierge medicine. So I will say the brief discussions I've had on this, because I work in a hospital, the patients that I've talked to who have concierge or direct primary care really like it. And they've often told me that they have had doctors who focus more on metabolic health, but it may be a very select group that I've talked to. And by the way, Ben, if you become a concierge doctor ever, I will be your first patient, and you'll give me it for free. So
no chance. You're getting charged up.
Double. Okay. I'd have you as my doctor any day. You're fantastic. But do you want to talk briefly, because people might be confused the difference between direct primary care and concierge medicine, because I'm sure a lot of people watching really want to try to get out of the system. My understanding is direct primary care is more affordable than concierge medicine.
It's a bit of a different model. So concierge medicine is kind of usually a yearly fee that's tacked on. And then there's the additional, usually, fees. Sometimes they still require insurance, things like that. Direct care is usually quite a bit cheaper. I've seen it as much as $120 to $150 a month, typically, that they'll tack on. And then they have some other charges involved. It's not the same access that concierge gives you, where the person's pretty much available 24/7, but it's still a fair amount of access. They do tend to utilize mid-levels like nurse practitioners and stuff more, from my understanding. So it's a bit different.
It can be a little more tiered in the pricing structure. So you could see a nurse practitioner that's directed under primary care, but you're paying less per month. And so, and some of the costs actually can be somewhat reasonable if you look at what you buy or may pay for like a cable bill, but I get it. I mean, it's a tough model, but again, if, word of mouth, I think, is always the best way of finding a good doctor, especially in communities. I don't love like a lot of like websites that do almost like restaurant reviews on doctors. I think like you can look really good on paper and really not be like, it's like bench to bedside. You could be like really good in the lab, but not good at like directing with patients and communication. I do think that it is a good way and route of going, but you really have to make sure that what you're paying for is a really quality doctor who really knows about functional health as well and metabolic health.
Agree. Absolutely. So let's have closing statements then. We've covered a lot, but we want to come back to where we started. Medicare, by even the most mild projection, is not going to look the same in a few years. A lot of people watching are over 65 or approaching 65. What would be our advice for you on what to expect and what you can do? Dr. Peter, you want to go first?
Sure, I'd love to. I think really becoming your own advocate and really taking your health first, you're going to become less dependent on the medical complex as we talk about it. And really, you're going to prepare yourself for the medical system that's not going to be there for you. And you should never depend on that. And I think on a positive note, I have seen a shift of patients that are starting to be, again, more interested in metabolic health, proactive and not just reactive. And I think this is maybe the shift we need and for patients to really take control of their own health.
Okay. Well said.
I think in America, there's become the understanding or the paradigm that healthcare is a passive thing, that your health is passive, that you only need to take this med or you only need to see this person. When the truth is, it's an active thing. It's something you do every single day. It's something you have to take very seriously. It's work in a lot of ways. You have to put in the work to be healthy. And I think that's something that intentionally has been clouded from most people or has been hidden, that no, there's no work you have to do. You just have to come in and see us and take this medication and all will be well. And that's just not the case. There's an old saying that we don't hear it much anymore, but they used to say an apple a day keeps the doctor away. It just shows we used to understand exactly what you needed to do. You needed to eat well and be healthy. You don't hear that a whole lot anymore because people just don't say it, but maybe we need to start saying that again.
Well said as well. Okay. My closing statement would be, well, firstly, I'd echo a lot of what you said. Everybody who's over the age of 65, these are your golden years. You have worked hard your whole life, and now you're at the point where you want to enjoy quality of life, and you don't want to get sucked into the medical industrial complex. It should be the last resort, and the system as you know it today is going to probably not be there for you in the way that you imagine in a few years' time. So the more you can focus on everything we've said, metabolic health, and also stay empowered, stay educated. There's a variety of different ways to do that now. We are blessed to be living in an age where at the click of a button, you can listen to different opinions, including our opinions. You're watching us right now. You couldn't have done this 30 years ago. But listen to a wide range of opinions. See who you gel with. Think to yourself, your gut instinct, is the person I'm listening to, do they have my true health and well-being at heart? Do they seem like they want me to be my best possible self? Use your own gut instinct. Listen to a wide variety of sources. Cover all the topics. If anything is wrong with you, obviously seek help. But the best thing you can do is to not need the system. And if and when you do need it, hopefully you're in a place where you will have a good doctor taking care of you and you'll have a system which will get you what you need. So I will finish with that statement. Thank you, everybody, for watching. Your success is our success. We know how hard a lot of people who watch these discussions are trying to do the right thing every single day. You want the best possible health as naturally as possible. You know that the system is completely broken and you want to take more into your own hands. So best of luck to you. Check in the links down below again for our separate Doctors of Ojai channel, also our natural health and well-being store. We're very excited to be expanding the range of products in the store, including more teas coming soon. This is our organic chai. Cheers to you. And also all of our natural supplements, ohiwellness.com if you're in the USA, North America, ohiwellness.co if you're in the UK, Europe. Take care. We'll speak next time.